In the metastatic breast cancer session, we saw the results from the IMpassion130 study as well as IMpassion131 study. These studies both evaluated Atezolizumab in combination with either paclitaxel or Nab-paclitaxel as first-line therapy for patients with metastatic triple-negative breast cancer. Interestingly, one study was positive, the other was negative. The study with Nab-paclitaxel plus Atezo was positive, showing an improvement in overall survival with the combination of Nab-paclitaxel plus Atezo versus Nab-paclitaxel without Atezo. On the other hand, the trial with paclitaxel was negative. There was no improvement in either progression-free survival or overall survival with paclitaxel plus Atezo as compared to paclitaxel without Atezo. As to why the results were different between these studies, it remains to be seen. Is it an effect of steroids that is used with paclitaxel? Is there a difference in the study population, the prior use of taxanes? So we need more biomarker data as well as deep analysis of these studies to understand why there was a difference between these two studies. The other results that were presented in the metastatic breast cancer session included the overall survival from SOLAR-1, which showed a numeric improvement in overall survival with the addition of Alpelisib to Fulvestrant as compared to Fulvestrant plus placebo. This was not statistically significant, but there was a trend towards improvement in overall survival. In terms of other studies at ESMO, in early breast cancer, we heard the results from both PALLAS as well as monarchE. So as a reminder, PALLAS was a trial looking at adjuvant palbociclib with endocrine therapy versus endocrine therapy without palbociclib, while monarchE looked at abemaciclib, another CDK4/6 inhibitor, in combination with endocrine therapy versus adjuvant endocrine therapy without abemaciclib. And interestingly, one study was positive, the other was negative. The PALLAS was negative. It did not show any improvement in invasive disease-free survival with the addition of palbociclib. On the other hand, the monarchE showed an improvement in invasive disease-free survival with the addition of abemaciclib. Now, why was one study positive, the other negative? We'll have to look deep into the data. The percentage of patients who discontinued palbociclib in PALLAS was pretty high, close to 50%, and that could have contributed to the negative results. monarchE was presented, early, and Dr. Sledge commented that probably it was presented too early because majority of patients have not completed the 2 years of abemaciclib therapy, so longer follow-up would be needed to see if the improvement in invasive disease-free survival means that patients were cured, or was it that patients already had micrometastatic disease, and this is what we would expect in the first-line setting. So metastases were delayed, but the patients were not necessarily cured. So additional follow-up would be needed for the monarchE study.